Hello and welcome to our next module in the American Indian webinar series for the Maternal Health Learning and Innovation Center. Again, my name is Dr. Donald Warne, and for this module, we will be talking about tribal community engagement and building trust. So what we'll discuss in this session is looking at some American Indian and Alaska Native demographics. We'll also go through some definitions, including defining what is a tribe and what is tribal sovereignty. These are important issues to keep in mind as we go through the process of engaging tribal communities. We'll also describe the importance of a land acknowledgement and acknowledging where we are in physical space and acknowledging the original inhabitants of the lands in which we work. We'll also look at culture and health as it pertains to tribal community engagement. Briefly, some of our maternal and child health disparities to have a better understanding of why it's so important to engage our tribes effectively. And then we'll end with the discussion on effective strategies for community engagement. Regarding our demographics for American Indians and Alaska Natives, the 2020 census revealed that there were 9.7 million people, or nearly 3% of the US population, who self-identify as American Indian and Alaska Native. So this is either American Indian, Alaska Native alone, or American Indian, Alaska Native in combination with another race. So our numbers increased dramatically between the 2010 and the 2020 census. And our numbers are going up, I think, because in truth, our population is growing, but there's also been significant outreach and engagement to try to increase census participation. So 9.7 million people as of the most recent census. And again, this is self-identified racial data on the US Census. We have 574 federally recognized tribes that are located in 36 states across the US. What this means is that we also have decreased advocacy and representation at the federal level. So if we have 36 states that include federally recognized tribes, that means we have 14 states that do not. So therefore, 28% of the Senate has no tribes in their jurisdictions or constituencies. So we are automatically at a disadvantage from a political and advocacy perspective because we don't have tribes in every state. And we have, even though our numbers are growing, we're still a relatively small minority population. We also have to recognize that the tribal lands are sovereign nations within the US, so 574 sovereign nations within the United States. And the land base is over 100 million acres, of which 44 million acres are located in just the state of Alaska. Here's a map of the American Indian reservations. In purple, these are the federally recognized tribes. So those 574 federally recognized tribes that have a relationship with the federal government. It is interesting to note that of those 574 tribes, over 200 are located in Alaska, and they typically have smaller communities and villages, but typically they do not have larger reservations. There's also over 100 federally recognized tribes in California, but most of them are also very small in terms of population numbers and land base. So other parts of the country, particularly in the western half of the US, we can see that there's much larger reservations. So we might not have as many federally recognized tribes in states like North Dakota and South Dakota, but the ones that are here are much larger in terms of land base and population of people. So it's important to keep in mind that there's a great diversity across the US in terms of federally recognized tribes and whether or not they have a large land base or a large population. In green, those are the state recognized tribes. So there are quite a few tribal nations in the US that are not recognized formally by the United States government, but the states do recognize their existence. So you can see it's predominantly in the southeastern part of the United States where we see state recognized tribes as opposed to federally recognized tribes. And the reason this is important is that in order to have access to Indian Health Service programming, including maternal and child health through the IHS, you have to be a federally recognized tribe. And as we can see, the vast majority of those tribes are in the western half of the United States. Here's some more data from the US Census, and this looks at the percentage of each state's population in terms of American Indians and Alaska Natives. And we can see now we have quite a few states that have at least 6% American Indian or Alaska Native population. So those 7 states include Alaska at 22% of the population being indigenous, as well as Oklahoma, New Mexico, South Dakota, Montana, North Dakota, and Arizona. So there are 7 states now that have at least 6% American Indian or Alaska Native population. And you can see other states that have significant numbers include states like North Carolina, Nevada, Idaho, California, Colorado, Kansas, Arkansas, Washington State, Oregon, and Wyoming. So again, the majority of states that have significant numbers of American Indians are in the western half of the US, and certainly the vast majority of federally recognized tribes are also in the western half of the United States. So what is a tribe? What are we talking about? And there's actually several ways to define a tribe. A tribe is a cultural group. So for example, I am Lakota, so we consider the tribe as a cultural group being Lakota. There's also other tribes like Navajo, that's a cultural group. But a tribe is also a political entity. So we have federally recognized tribes that are political entities that have a government-to-government relationship with the federal government, whereas the state-recognized tribes have a government-to-government relationship with the state that they are located in, but not with the federal government. So a political entity as a tribe also means that our political tribes are not the same as the cultural groups. And I'll explain that in the next few slides. So the cultural group is the larger culture of a tribe, whereas a federally recognized tribe is a unique political entity. In addition, for our tribes, we have our traditional names and then the legal names. Almost every tribe was renamed at some point in history. So for me, the Lakota, Dakota, and Nakota peoples are what we call the Oyate. And we were renamed Sioux, S-I-O-U-X, the Sioux Indians. And actually the word Sioux is a shortened word from the Ojibwe language that means snake or enemy. And it's written in French, French spelling, because it was the French colonizers that renamed us the Sioux Indians. So we don't call ourselves historically Sioux. That was a renaming of our people. And the same is true for some other larger tribes, including the Navajo. They call themselves the Dene people, and they were renamed Navajo. So in some cases, you'll see the traditional names being used, like Oyate. In some cases, you'll see the more modern renaming of the tribe being used. So this is a map of North Dakota and South Dakota, and looking at the tribal nations that are located here. I would mention that we see some terrible health disparities among the people who live in North Dakota and South Dakota. And for the tribal members, we tend to see very early age at death, unfortunately. The average age at death for American Indians in the Dakotas is around 58, whereas the average age at death for the white population in the same states is closer to 79. So we're seeing about a 21-year difference in average age at death for people who are American Indian living in the Dakotas as compared to the rest of the population. So when we look at South Dakota, and I have in the red circle is Oglala Sioux tribe, which is where I am from originally, but many of us call it the Oglala Lakota Nation. So some tribes are still using the renaming because the legal renaming of our federally recognized tribe was Oglala Sioux tribe. So you can see that's relatively consistent with Rosebud Sioux tribe, Yankton Sioux tribe, Lower Brule Sioux tribe, Crow Creek Sioux tribe, Cheyenne River Sioux tribe, Standing Rock Sioux tribe. So you get the idea. One of the Dakota nations, the Sisseton, Wahpeton, Oyate, they're using the traditional word Oyate. But Oyate was renamed Sioux, and for most of the tribes in South Dakota, they have not formally changed the name to the traditional name. That is in process for many of our tribes. So the reason this is important is that the Oyate is a tribal group from a cultural perspective with Lakota and Dakota peoples. So in the western half of South Dakota, Standing Rock, Cheyenne River, Oglala, Rosebud, and Lower Brule are all Lakota tribes. And Yankton, Crow Creek, Flandreau, and Sisseton are Dakota tribes. But even though we're one tribal group from a cultural perspective, that's actually 9 federally recognized tribes. So it's important to keep in mind that the federally recognized tribes are not the same as the cultural group. And in South Dakota, the one cultural group has been divided into multiple federally recognized tribal nations. I'd call your attention to North Dakota. In Western North Dakota, there's a large tribe called Mandan, Hidatsa, and Arikara Nation. And this is one federally recognized tribe, but it's actually 3 tribes from a cultural perspective. So the Mandans, the Hidatsas, and the Arikaras are all separate tribes from a cultural perspective. They each have their own language and their own histories, but they were brought together as one federally recognized tribe. And the reason that occurred is that there was a terrible smallpox outbreak in the 1800s, and they went from tens of thousands of tribal members to about 130 people who survived that smallpox outbreak. So with small numbers, they were brought together as one federally recognized tribe, even though there are 3 tribes there from a cultural perspective. So just important to keep that in mind when we're talking about tribal community engagement. We need to understand, what is it that we're talking about? Are we talking about a tribe as a cultural group, or are we talking about a federally recognized tribe as a political entity? So that's some background on the tribes. It's also important when we're working anywhere in the United States that we acknowledge the original inhabitants of the land. So there's been a large movement toward promoting land acknowledgement. And a land acknowledgement is a traditional custom that's actually centuries old in many of our native nations and communities, where we would acknowledge the people who reside in the particular territory that we are visiting. Today, land acknowledgements are used by Native peoples and non-natives to recognize Indigenous peoples who are the original stewards of the land on which we now live. If you are interested, there's a wonderful guide to Indigenous land acknowledgement through the Native Governance Center, and I have the website here on this particular slide. So depending on where you work in the United States, it's important to recognize that every bit of the US has a history of Indigenous peoples. So we should acknowledge Indigenous peoples. And when we're looking at tribal community engagement, I think it's a meaningful show of respect to acknowledge the original inhabitants. Also, if you're interested, there's a really good website that actually looks at the original inhabitants worldwide and Indigenous populations. So this website is native-land.ca. And you can actually hover over this map and determine who are the original inhabitants, not just the US and North America, but around the world. So this is an interactive website so you can see where, or in each part of the world, where the original inhabitants are and who the Indigenous peoples are. And believe it or not, in the US, you can actually text your city and state to this phone number, 907-312-5085, and that will tell you whose land you're on at that particular time. So there's a lot of movement toward acknowledging Indigenous peoples and the land upon which we are now living and working. So that's background on the tribes as cultural groups and some of the land acknowledgement. Let's take a little bit of a deeper dive into tribal sovereignty. What does that mean? So tribal sovereignty refers to the legal recognition in the United States of the inherent sovereignty and self-governance of American Indian and Alaska Native nations. So we have a lot of treaties that are signed between the tribal nations and the US government, but the treaties did not create tribal sovereignty. That's kind of a misnomer. People think that the treaties are what are the basis for tribal sovereignty, but the tribes have considered themselves sovereign nations long before there was a United States or treaties or a constitution. So one of the other bases for federal Indian law recognizing tribal sovereignty is in the Commerce Clause in the US Constitution. So in Article 1, Section 8, the Commerce Clause, it states that Congress shall regulate commerce with the foreign nations and the Indian tribes. So going back to the US Constitution, there was recognition of tribal nations essentially being on par with foreign nations and recognizing that tribes have an inherent right to govern themselves. So tribal sovereignty is complex, and I would encourage you to learn more about it and learn the federally recognized tribes that might be located in the state in which you live and work. And tribal sovereignty really consists of our systems of knowledge and ways of being. And this includes cultural ways, spiritual practices, language, social and legal systems, political structures, and of course, the land and waters within our territories. The Indian Health Service is the federal agency that is charged with the responsibility of providing healthcare services to American Indians and Alaska Natives. And Indian Health Service is an agency within the Public Health Service and Department of Health and Human Services. And they serve about 2.6 million American Indians and Alaska Natives. So it's important to recognize that in the census is 9.7 million self-identified American Indians and Alaska Natives. So the IHS actually serves a minority of American Indians and Alaska Natives. So for example, for myself, I live in Grand Forks, North Dakota, and there are no IHS facilities. And I also happen to have health insurance. So I do not have to go to the IHS for my healthcare. I can go to the private sector. So there's many people like me who are not in the IHS database. So something to keep in mind. IHS was established in its current form within the Public Health Service in 1955, and its role is to meet the treaty obligations of the US to provide health services to members of federally recognized American Indian and Alaska Native tribes. Just very briefly, as we're looking at tribal community engagement, we should also be aware of the cultures and indigenous ways of knowledge and indigenous ways of healing that our tribes have. So there's a great deal of diversity among the tribal nations, but each has its own culture, community, and history of ceremony. A very common symbol is what's called the medicine wheel, and that shows the four aspects of a human: the spiritual, mental, physical, and emotional components, and how to be healthy, we have to be in balance in all four directions. Also, tribes have their own history of medicine people, medicine men and medicine women, and traditional healers. And many tribes still have thriving traditional medicine practices. So as you are engaging tribal communities, it's very important to know what is their current connectedness to traditional medicine and indigenous knowledge systems. Well, we also recognize that, of course, we've seen tremendous changes to indigenous land in the United States. And of course, when we look at the entirety of the US, at one point it was all indigenous land. But with colonization and further growth of the United States, our population is now on those reservations that I had described. We also saw a significant loss in our population. It's estimated that there were probably 5 million or so indigenous peoples in the US at time of contact in what is now the United States. But if we look at the Americas, there are probably over 20 million indigenous peoples in the Americas. And then by 1900, that number had dipped down to about 200,000. So we've seen our numbers increase since that time frame, but it's important to acknowledge that there's a lot of trauma that has occurred and a lot of loss in American Indian and Alaska Native populations. And that sense of trauma and loss is prevalent even today. So when we're looking at community engagement, we need to be cognizant of that. Another consideration is that we still see terrible disparities. This is from a report just released in September of 2022, looking at decreases in life expectancy. And for essentially every population in the US, we saw a decrease in life expectancy between 2019 and 2021 because of the COVID-19 pandemic. But it was even worse for the indigenous population. And this is remarkable. We saw life expectancy fall from about 72 years to about 65 years. So nearly a 7-year loss in life expectancy for American Indians and Alaska Natives. And to put this in perspective, a life expectancy of 65.2, that's the life expectancy that we saw for the average American back in 1944. So we've really taken a step back in time. And as we're conducting community engagement around maternal and child health, we really need to be cognizant that our communities are suffering from terrible disparities, and they are very cognizant of those disparities. This has been an ongoing problem. I know this is kind of a busy slide, but the blue bars are the American Indian population, the yellow bars are the white population. This is in the state of South Dakota. And again, we can see much earlier age at death. The x-axis is the age group from 0 to 100. And then on the y-axis, that's the percentage of deaths within those populations at that year or age in which people died. So we can see there's a spike in infant mortality in South Dakota. Nearly 5% of all deaths were among infants during this time frame. And we can see again, earlier age at death for American Indians in South Dakota. We repeated this study in North Dakota for the decade prior to the pandemic and saw basically the same pattern in which we have higher rates of infant mortality and earlier age at death. So these are important considerations as we're conducting community engagement and recognizing that we have earlier age at death and certainly higher infant mortality rates in the state of South Dakota, much worse infant mortality rate compared to the rest of the population. So 8.9 deaths per 1,000 births as compared to 6.2 for the overall population. And the disparities are even worse in North Dakota with 9.4 deaths per 1,000 live births as compared to 5.5 for the general population. And we also know that maternal mortality is much worse. So 3 to 4 times more likely than white women, American Indians will have death due to complications related to pregnancy or childbirth. And much more frequently, we'll see maternal morbidity and greater rates of gestational diabetes and preeclampsia. So a lot of significant maternal, infant, and child health disparities in the American Indian and Alaska Native populations. So that's an important backdrop to understand as we're planning for community engagement. And this is one of the better documents focused on principles of community engagement through the US Department of Health and Human Services, and in particular CDC took a lead role in developing these principles of community engagement. And I like the framework that they use, that there's a spectrum of level of community engagement, from simple outreach in which there's some community involvement to consulting the communities in which there's a little bit more community involvement, and we share information in that process. Then there's involvement of the community, which is better community involvement, and then we can see communication flowing both directions and we can cooperate with each other. Then there's collaboration, in which the communication flow is bi-directional and there's formal partnerships made in that process. And then ultimately shared leadership, where it's strong bi-directional relationship with the communities. Final decision-making is at the community level. And the outcomes there, we're trying to look at having a positive impact on health outcomes with shared leadership and genuine community embeddedness and relationships that we build. So in that document, they talk about 9 principles of community engagement. We won't go into great detail with each of them, but be cognizant that there's some really good evidence-based practices for effective community engagement, and these can be applied to tribal communities in many circumstances as well. So before starting community engagement, one, we need to be clear about the purposes or goals of the engagement effort and the populations or communities that you want to engage. And for tribes, it's very important to engage tribes with very clear purpose. And it's also very important to have a champion from within the community, and ideally having Indigenous staff members and program officials and researchers and others that are working within the organization to assist in that connectivity with tribal communities. Also, it's important to become knowledgeable about the community's culture, economic conditions, social networks, political and power structures, norms and values, and demographic trends. It's also important to know the history and the previous experience that the communities had with outside groups. And again, for American Indian populations, we're acutely aware of our history, and many of the communities are closely connected to historical trauma and some of the challenges that we've had. So before starting community engagement, be clear about the purpose of the engagement and really understand the history and culture of the communities that you're working with. For engagement to be successful, we need to partner with the community and have genuine collaborations and partnerships. And all aspects of community engagement must recognize and respect the diversity of the community. And we need to recognize that for tribal communities, it's not a one size fits all. As I had shown, some of the tribal communities are very large with significant land base and population. Some of the communities are very small. In addition, there's a multitude of languages and cultures and histories. So it's important to really understand the individual tribal communities that we're trying to work with. For engagement to succeed, we have to have sustainable community engagement. And we also have to recognize that the community does have assets and strengths. So we can't just focus on the disparities and the deficits. We have to recognize that even in tribal communities where we see a lot of disparities, we have a lot of strengths and assets, particularly cultural connectedness that we see within our communities. We also have to recognize that for organizations that want to engage communities, they must be prepared to release control of actions and have shared leadership as we move forward with engagement. And that certainly applies to developing maternal and child health programming. And then finally, community collaboration does require long-term commitment and making sure that our organization and our partners are committed to staying engaged with the communities for a long period of time. And ideally, having that long-term connectedness with tribal communities, ultimately our goal would be to decrease these terrible disparities that we are seeing in our populations. I hope that's very helpful in terms of thinking about principles of community engagement and some key considerations to keep in mind as we're engaging tribal communities. And please do feel free to reach out if you have any additional questions.